focusing here on the skill of measuring glucose. If you're interested in learning more about the clinical implications of glucose monitoring, you can check out our endocrine emergencies class here on Prodigy. The key to performing any skill is proper preparation. For this, you'll need a glucometer, test strips, a lancet, alcohol prep pad, gauze, ideally something small like a 2x2, and a small bandage. While you prepare the equipment, you can have the patient hang their hand down by their side, which will help to get blood flow to the hand and make it easier to obtain a blood sample. Next, let the patient know what you're doing and let them know that they feel a little pinched during the procedure. You want to choose a finger that will be most comfortable for the patient. Ideally, you'll use the third or fourth finger of the non-dominant side. If you're measuring glucose of a diabetic patient, they may have a preference for where you obtain the blood sample. You should use the side of the finger and avoid using the tip or the pad, as this will just be more comfortable. Clean the area with an alcohol pad and let dry. Not allowing the alcohol time to dry can result in a bad reading. Ensure the glucometer is on and place in a test strip. Most glucometers will turn on as you place the test strip in and don't have a separate on-off button. Most agencies are using a single-use spring-loaded lancet. If your agency is using a reloadable device, ensure that the needle is properly loaded. Do not use just the needle alone without it being loaded in, as you'll have an unprotected sharp and it's a lot more uncomfortable for the patient. When you stick the finger, you should see blood start to pool on the surface of the skin. Many protocols call for wiping away the first drop of blood, and this will result in a more accurate reading. However, in patients that are difficult to obtain a finger stick blood sample from, the first drop may be used. Research has shown that the difference in values between the first drop and the second drop of blood is small and well within clinically acceptable ranges. If you're not getting blood return, you may gently squeeze the finger. Avoid vigorous squeezing or strong pressure, as it may cause release of excessive tissue fluid or hemolysis, which can lead to inaccurate sampling. If insufficient blood is returned, you may need to attempt a second stick at a different site. Next, place the sampling area of the strip next to the blood drop and allow it to be drawn in. You do not want to place the blood sample on top of the strip, which will result in an error and no reading. The measured number should be recorded as milligrams per deciliter. Finally, wipe away any excessive blood and place a bandage over the site. Those are the general steps for obtaining a blood glucose sample. You should make sure you're familiar with the exact equipment that your agency uses for blood glucose monitoring.